The Cruz family is comprised of the mom, Mina, 40 years old, and her husband, Gary, 45 years old. They are blessed with 3 kids and a new baby. The eldest among the siblings is Trina, who's 15 years old. The second one is Tony, followed by the third child, who is Tanya, and the recent baby, who's named Tara. Mina immigrated from the Philippines to Toronto last 2000. After 2 years, her husband and 3 kids came to join Mina in residing in Scarborough. The current health status of the family is fair. Due to certain illness with each family members, they are able to maintain good health and stable condition. Mina has been experiencing extra fatigue after giving birth to her youngest child, given the fact that she gave birth at 40. Mina did mention that her stamina has not been the same as when she had her previous kids. Due to the recent changes of employment, Gary has been feeling a little bit more distant to his family. His wife would often notice that Gary would be very quiet and would not engage as much as how he was before with the kids. Mina focuses her care to her kids, most especially to their newborn baby. She understands that she has to be strong for the family at this time, and she also has to look after their needs. Mina often seeks advice from her close friends, who are also residents of the same building. At times when Mina have to go to a doctor's appointment and her husband is not available, she leaves her kids to Edna for a couple of hours.
Development of a health problem. Gary's type 2 diabetes worsened after he was laid off from his works, which is in Sears. In line with this, he experienced depression. Gary often wants to be alone and distant himself from his family. While Mina experienced severe fatigue after giving birth to their fourth child at 40 years old, while Tony, the second child, which is 10 years old, has severe eczema and skin allergies that limit him to be with other children and playing outdoors. Tanya, which is the third child and 6 years old, has asthma and will flare up during the cold season. The recent financial issues created more health problems and changed the family dynamic. The family has moved by the sudden changes the situation brought in the family.
Impact of the health problem. According to Papadopoulos, be it acute or chronic, an illness in the family can have a profound effect both on the person that is experiencing the illness and on the dynamics of that person's family. It means that Gary was emotionally changed because of the problems they are facing, and Mina is thinking if she can come back to her work, but she doesn't know who is going to look after the kids, especially with her baby. Mina is worried about the financial needs because of not enough income. The outcome of being part-time cleaner of Gary and Mina was in maternity leave. It brings them a financial stress in which Ori states that financial stress can contribute to poor physical and mental health for both you and your children and can affect your job performance and can cause physical illness, especially if a person experiences high stress with little emotional support or feels stress for an extended period of time. Number 2, a change in family structure may contribute different things within a family. An addition of a child may show change of income generation, as it would mean there would be changes in the income generating couple to provide for the family and may move them to a more lower income category.
So here are the clinical reasoning that we consider to help this family. Job loss increases marital conflict, ups the risk of divorce, and leads to more ineffective parenting, sometimes too harsh, sometimes too neglectful. Children pay a severe price for the hard economic times their parents endure. When serious illness or disability strikes a person, the family as a whole is affected by the disease process and by the entire healthcare experience. Patients and families have different needs for education and counseling. because each person in the family plays a specific role that is part of the family's everyday functioning. The illness of one of the family member disrupts the whole family. When a family member becomes ill, other family members must alter their lifestyle and take on some of the role functions of the ill person, which in turn affects their own normal role functioning. To address the family's health issue and situation, it is important to identify what the illness means, not only to the individual but also to the family. Asking them what they considered major problems and how they plan to handle specific situations that can help assess the meaning of the patient's illness to the family. To help with Gary's unemployment, there are programs that could involve direct financial assistance to families, such as unemployment insurance programs, or they could help to promote parents' job search skills, training for a new occupation, or education in effective money management. To deal with families' health issue, they should seek help of medical professionals to further manage Gary's diabetes, Tony's severe skin allergy, and Tanya's asthma. So we have a free public health care system that is available for the family. To help Mina, it is normal as a wife and mother to feel overwhelmed trying to help her family and herself cope. Therefore, emotional support is helpful and necessary to cope up with their situation. As a caregiver to the family, she needs more interventions that could include skills training and assistance with problem solving. Illness can be stressful for an entire family. It is not unusual for couples to experience strain on their relationship. They should try to see things from each other's perspective and keep the lines of communication open. It is important for the couple to spend some time alone, to encourage each other to take care of themselves, to improve their own health and well being for the benefit of their families, especially their children.
Hi there, my name is Michelle Diano. The first part of the discussion is with regards to the legend. There are 4 legends in our eco map. There's the positive relationship, a strong relationship, strained relationship, and negative relationship. The eco map shows the relationship amongst the members of the family. Also, it shows the relationship of each members of the family to the society, to their support system, and to the environment. In the eco map, you will see that there is a strong relationship between several members of the family, mostly with the siblings Tara, Tony, Tanya, Trina, to their mom. There is also a strong relationship between Mina and Edna, who is her neighbor and who supports the wife in a way with helping her look after the kids. A positive relationship was shown between several members of the family, especially within the siblings, and also towards the family physician. Mina, who is the mom, also has a positive relationship with the factory work or the work company, as they were able to support her with going back to work if she needed. There is also a positive relationship between Trina, Tony, Tara, and Tanya. Now there is a marked relationship, a negative relationship between the father, Gary, towards Mina, the wife, and toward the siblings, towards their dad. As you can see, with what had happened, there are things that they can't control, such as Gary losing his job after several years. So in our eco map, it shows that there is a negative relationship between the previous company that Gary was connected with. Even though Gary started to show signs of being depressed, he still had a positive relationship with one of his neighbor, which is Nilo. There is also a strained relationship between Tanya towards the school because of inability to join activities at times. And there has also been strained relationships between the father and the kids due to the different changes happening around them, most especially concerning with sustaining the needs of the family. Now we're gonna go to the eco map. The eco map, or the genogram rather, the genogram is gonna discuss about the condition of the family. Mainly with Mina, she's 40 years old and she has been experiencing extreme fatigue, most especially after giving birth at 40 years old. Mina gave birth to their fourth kid at the age of 40, and she already said that she has been experiencing more stress and fatigue after giving birth compared to the previous pregnancy. The husband has been diagnosed with type 2 diabetes. The husband is Gary. He's 45 years old. The firstborn is Trina, 15 years old. She doesn't have any medical concerns at the moment. The second child is Tony. He is 10 years old and he has been suffering from severe eczema and skin allergies, which tends to worsen during winter time. The next kid is Tanya, who is 6 years old and who has been suffering asthma for several years now. It was noted that when Tanya would be joining some swimming class, she is able to control asthma attacks better. The youngest amongst the siblings is Tara, who is 3 months old. In our genogram, as you can see, the circle represents the female in the family. The square represents the male in the family, as shown in our diagram.
The demonstrating manners. Engaging authentically with family in decision-making processes. Appreciating family effort to help in the situation and their choices. Communicate effectively with each family member. Exhibit non-judgmental, non-criticizing affect and neutral. Maintain confidentiality and respect privacy.
Hello everyone, my name is Jacqueline Gamayan Perez and I'm going to report the 5 therapeutic questions and also the psychosocial considerations. Number 1 on the therapeutic questions. How can we be most helpful to you and your family during our meeting together? The rationale for this is to clarify expectations and also increases collaboration. The next question is, what are the greatest challenges facing your family during this illness? Rationale indicates actual or potential suffering roles and beliefs. Number 3, with which of your family members or friends would you like us to share information? With which ones would you like us not to share information? Rationale indicates alliances, resources, and possible conflictual relationships. Who do you believe is suffering the most in your family during this time of illness? Rationale is to identify family member who has the greatest needs for support and intervention. What is the one question you would most like to have answered during our meeting right now? I may not be able to answer this question at this moment, but I will do my best or I will try to find the answer to you. Rationale is to identifies most pressing issue or concern. Psychosocial considerations. Being aloof of the husband, Gary to his wife and kids. Mina has been experiencing extra fatigue after giving birth. Gary has been diagnosed as type 2 diabetic about 4 years ago. Tony is suffering eczema and skin allergies, which limits him in interacting with kids and playing outdoors. Tanya is suffers from asthma, which is lesser attacks during summer season and get more worse during the cold season. Gary is preferred to talk to his friends rather than his wife. The impact of being part-time worker of Gary. Mina is seeking advice to her close friends and finds comfort and support with Edna. The family does not have any relatives in Toronto and values their friends as their own family.
Recommendations that we could offer to the family, to this family. And we have also some sample script for the nurse to say during the interview. Number one is Mina and Gary waited for 2 years to make their family complete and be together. They sacrificed and endured living separately across the world just to secure the future of their family. Their children saw their commitment, love, and care for the whole family. So the nurse would say marriage has its ups and downs. They say that the ultimate test of love is being in a long distance relationship. And if you pass it, you will overcome anything that has come your way in your married life. I am very inspired and impressed how your family overcame this test. I can see you value family with commitment, love, and care with one another. Next is the family spend time together, communicate each other, share the same cultural background and faith, and going to church together, which strengthens relationship and builds a solid foundation for future life goals. So the nurse would say, I admire your family for working together towards achieving a goal. Socialization of family members is a major function in families and accomplished in a variety of ways. You make time for your family. I can see that as a parent, you projected being a good role model to all your children. Next is with Gary's dedication and hard work to provide for his family despite dealing with his own illness. The nurse would say, I admire you for being so brave in dealing with your illness and still manage to work for your family. Your perseverance, love, and dedication to provide for your family seems like what keeps you going. Next is Mina's strength and courage in dealing with difficult situations. It is impressive that she is aware that in order for her to take care of her family, she has to take care of herself too. So the nurse would say, I noticed that you handled your situation with strong determination and great skill. It is not easy taking care of your family by yourself, but you managed to pull through. I admire your courage and strength to take care of your children, your husband, and yourself. And the last one is having a support system that the family can trust is very important. Like Mina, who finds comfort and support with her friend and neighbor Edna. So the nurse would say, sometimes when life gets tough, all you need is a friend you can count on. Real friends are hard to find, but I think you found one that you can trust and you can depend on in times of need.
Hello everyone, this is Emmanuel from Group 5. Today I am only discussing the 3 priorities about the care plan for the Cruz family. The first priority is the depression. Gary has depression, being aloof, very quiet, less of interaction with his kids, finds comforts with their neighbor instead of his wife. So in this situation, I have to sit with him and do assessment and listen to his concern. We have to address his depression and identify the priorities and goals of care. We have to consider his values, beliefs, needs, and preferences. This will help the health provider in dealing with the intervention when we explore their experiences, goals, and preferences for health care. The second priority is to treat the eczema. His son Tony has severe eczema and it has become an issue with his being isolated from his peers. Many cases of eczema clear or improve during childhood, whereas others persist into adulthood. Some children who have eczema will go on to develop asthma or allergic rhinitis. Health providers should consider a diagnosis of food allergy in children with eczema who have reacted previously to a food with immediate symptoms or an infant and young children with moderate or severe eczema that has not been controlled by optimum management, particularly if associated with gut dysmotility such as colic, vomiting, altered bowel habit, or failure to thrive. We must use a step approach for managing eczema in children. This means tailoring the treatment to the severity of the eczema. The third issue is to control Gary's diabetes. Support the person and their family members in developing attitudes, beliefs, knowledge, and skills to self-manage diabetes. Provide dietary advice in a form of sensitive to the person's needs, culture, and beliefs, being sensitive to their willingness to change and the effects on their quality of life.